Have you been taking Amlodipine, Losartan, or Lisinopril for years? If you're over 60, you may believe that feeling tired, dizzy, having swollen ankles, or developing a dry cough is simply part of getting older. But what if some of these changes aren't caused by aging at all? What if they could be related to the blood pressure medication you take every single day? Now, this does not mean you should stop taking your medicine. In fact, these medications have helped millions of people control high blood pressure, protect their hearts, and lower the risk of stroke. For many patients, they are safe, effective, and life-saving. However, like all medications, they can sometimes cause side effects. The challenge is that these side effects often develop slowly. They may be mild at first, making them easy to overlook or mistake for normal aging. As a result, some people continue living with symptoms they never think to discuss with their healthcare provider. In today's video, we'll explore 6 possible side effects of Amlodipine, Losartan, and Lisinopril that every adult over 60 should know. We'll explain why these symptoms can happen, which medication is more commonly associated with each one, and when it's important to talk to your doctor. Remember, every person responds differently to medication. Some people experience no side effects at all, while others may notice changes that deserve attention. The goal of this video is not to create fear, but to help you become a more informed and confident partner in your own healthcare. Stay with me until the end, because the final side effect is one that many people ignore for months, even though a simple conversation with their doctor could make a significant difference. Welcome to Dr. Bilal, where we make medical information simple, practical, and easy to understand so you can enjoy a healthier life after 60. Now that you know why it's important to pay attention to possible medication side effects, let's look at the first 2 symptoms. Remember, these side effects do not happen to everyone, and you should never stop taking your medication without first speaking to your healthcare provider. Side effect number 1, swollen feet and ankles. Have you noticed that your shoes feel tighter by the evening, or perhaps your socks leave deep marks around your ankles? For many adults over 60, this is often blamed on aging or spending too much time standing. However, if you're taking Amlodipine, swollen feet and ankles, also known as peripheral edema, can be a possible side effect. Amlodipine works by relaxing blood vessels so blood can flow more easily, helping to lower blood pressure. In some people, this relaxation allows a small amount of fluid to collect in the tissues of the lower legs and feet, leading to noticeable swelling. The swelling is usually painless, but it may become uncomfortable after a long day. While it is often not dangerous, you should mention it to your doctor. Sometimes adjusting the dose or switching to a different medication can reduce the problem. However, if swelling appears suddenly, becomes severe, or is accompanied by chest pain, severe shortness of breath, or one leg becomes much more swollen than the other, seek medical attention immediately. Side effect number 2, a persistent dry cough. Have you developed a dry cough that simply won't go away? Many people assume it's due to allergies, a lingering cold, or even aging. But if you're taking Lisinopril, the medication itself could be the reason. Lisinopril belongs to a group of medicines called ACE inhibitors. In some people, these medications increase levels of a natural substance called bradykinin, which can irritate the airways and trigger a dry, tickling cough. This cough is usually not harmful, but it can become frustrating, especially at night. It often doesn't produce mucus and may continue for weeks or even months if the medication remains the same. If you've had a persistent cough that started after beginning Lisinopril, don't stop the medication on your own. Instead, talk with your healthcare provider. They may decide to switch you to another blood pressure medicine, such as an ARB like Losartan, if it's appropriate for your situation. These first 2 side effects are among the most commonly discussed, but they are only part of the picture. Now, let's continue with 2 more possible side effects that are sometimes mistaken for normal aging. Many adults over 60 simply accept these symptoms as part of getting older, when in some cases they may be related to blood pressure medication or changes in blood pressure itself. Side effect number 3, dizziness or feeling lightheaded. Have you ever stood up from a chair and suddenly felt dizzy? Maybe the room seemed to spin for a few seconds, or you felt like you might lose your balance. Many people blame this on age, but it can sometimes happen because blood pressure drops too much, especially after starting a new medication or increasing the dose. Amlodipine, Losartan, and Lisinopril all work by lowering blood pressure. While this is important for protecting your heart and reducing the risk of stroke, blood pressure that becomes too low may reduce blood flow to the brain for a brief moment when you stand up quickly. This temporary drop is known as orthostatic hypotension. Most episodes last only a few seconds, but they can increase the risk of falls, which is a major concern for older adults. To reduce this risk, stand up slowly after sitting or lying down. Give your body a few moments to adjust before walking. Staying well hydrated may also help, unless your doctor has advised you to limit fluids. If dizziness becomes frequent, severe, or leads to fainting, contact your healthcare provider. They may recommend checking your blood pressure at home or adjusting your treatment plan. Side effect. Number 4, changes in kidney function. Your kidneys play an essential role in filtering waste, balancing fluids, and helping regulate blood pressure. Medicines like Losartan and Lisinopril are often prescribed to protect the kidneys, especially in people with diabetes or high blood pressure. However, in some individuals, these medications can also cause changes in kidney function, particularly when treatment is first started, doses are increased, or if a person becomes dehydrated. This is why doctors often order blood tests after starting these medications. These tests measure kidney function and help ensure the medicine is working safely. Most people will not notice any symptoms at all, which is why regular follow-up appointments are so important. However, if you notice unusual fatigue, swelling that is getting worse, a significant decrease in urination, or confusion, you should contact your healthcare provider promptly. These symptoms do not always mean your medication is the cause, but they deserve medical evaluation. The key message is this: regular blood tests are not just routine paperwork. They are an important part of making sure your treatment remains both effective and safe. These next 2 side effects remind us that even medications with proven benefits should be monitored carefully. Paying attention to your body and attending regular checkups can help detect potential problems early. Now let's look at the final 2 possible side effects. These symptoms may not receive as much attention, but they can still affect your daily life. The good news is that they can often be managed with the help of your healthcare provider. Side effect. Number 5. High potassium levels. One possible side effect of Losartan and Lisinopril is an increase in potassium levels, a condition known as hyperkalemia. Potassium is an essential mineral that helps your muscles, nerves, and heart function properly. But like many things in the body, balance is important. If potassium levels become too high, it can affect the way your heart beats. The tricky part is that mild high potassium often causes no symptoms at all. That's why doctors may recommend regular blood tests, especially after starting these medications or changing the dose. When symptoms do occur, they may include muscle weakness, unusual tiredness, tingling sensations, or in more serious cases, an irregular heartbeat. Certain salt substitutes and potassium supplements can also increase potassium levels. Before using these products, always ask your healthcare provider if they are safe with your medication. Regular monitoring is one of the simplest ways to keep treatment both effective and safe. Side effect number 6, fatigue or feeling unusually tired. Do you often feel low on energy even after getting a full night's sleep? Many adults assume this is simply part of getting older. While aging can affect energy levels, persistent fatigue may sometimes be related to blood pressure treatment or the condition being treated. Blood pressure medications lower the force of blood flowing through your arteries. As your body adjusts, some people may temporarily feel more tired than usual. Fatigue can also have many other causes, including poor sleep, anemia, thyroid disorders, dehydration, depression, or vitamin deficiencies. That's why it's important not to assume your medication is always responsible. If tiredness is severe, lasts for several weeks, or interferes with your normal daily activities, talk with your healthcare provider. They can help determine whether your medication, another medical condition, or a combination of factors may be contributing. What should you do? If you notice these side effects, the most important rule is never stop taking your blood pressure medication on your own. Suddenly stopping medications like Amlodipine, Losartan, or Lisinopril can cause your blood pressure to rise again, increasing your risk of heart attack, stroke, or other serious complications. Instead, keep a record of your symptoms. Write down when they started, how often they happen, and whether they are getting better or worse. This information can help your doctor decide if your medication should be adjusted or if another cause needs to be investigated. Continue taking your medicine exactly as prescribed, attend your regular follow-up appointments, and complete any recommended blood tests. These simple steps help ensure your treatment remains both safe and effective. In the final part, we'll summarize the most important lessons from today's video and share simple tips that can help you get the full benefits of your blood pressure medication while reducing the risk of side effects. Stay with me until the end. Now let's bring everything together. High blood pressure is often called the silent killer because it usually causes no symptoms until serious damage has already occurred. That is why medications like Amlodipine, Losartan, and Lisinopril have helped millions of people lower their blood pressure and reduce the risk of heart attacks, strokes, kidney disease, and other life-threatening conditions. But like every medication, they can also cause side effects in some people. Today, we discussed 6 possible side effects that adults over 60 should be aware of: swollen feet and ankles, a persistent dry cough, dizziness when standing, changes in kidney function, high potassium levels, and ongoing fatigue. Experiencing one of these symptoms does not automatically mean your medication is the cause. Many of these problems can also result from aging, other medical conditions, dehydration, or different medications. That is why it is so important to work closely with your healthcare provider instead of making changes on your own. If you notice a new symptom after starting a blood pressure medication, don't ignore it, but don't panic either. Keep track of when the symptom began, how often it occurs, and whether it is becoming worse. This information can help your doctor decide whether your treatment needs to be adjusted or whether another medical condition should be investigated. Remember, never stop taking your medication without medical advice. Suddenly, stopping blood pressure medicine can cause your blood pressure to rise quickly, increasing your risk of serious complications. You can also help protect your health by checking your blood pressure regularly, staying physically active, eating a heart-healthy diet, limiting excess salt, drinking enough water unless your doctor has advised otherwise, getting enough sleep, and keeping all follow-up appointments. Small, consistent habits often make the biggest difference over time. The goal of today's video is not to make you afraid of your medication. It's to help you become more informed about your health. When you understand how your medicines work and know what changes to watch for, you're better prepared to have meaningful conversations with your healthcare provider and make informed decisions together. Thank you for spending your time with Dr. Bilal. If you found this video helpful, please give it a thumbs up, subscribe to the channel, and turn on notifications so you never miss our latest evidence-based health tips for adults over 50 and 60. Take care of your heart, stay active, stay informed, and I'll see you in the next video.